Hey guys, this is Dr. Brian Castelein with Brighton Foot and Ankle, and today we want to talk about a hot topic called turf toe. Now, I was sitting on my couch watching some football on Sunday, and all of my friends from the Cincinnati area started to text me. I did go to school in Dayton, Ohio, so I do actually have friends in Cincinnati, and they are all worried about what's happening with their quarterback and how long is he going to be out. Well, I was trying to text them and saying that turf toe can be like a garbage term for a lot of things that happens down here to the base of the big toe. There's a lot of different structures down and through here, which we're gonna go over in a second, but let's talk about why is it called turf toe. Well, the name of this injury kind of arose as football started to be played on artificial surfaces such as turf. Now, these older surfaces back in the 70s, 80s, 90s weren't as forgiving as natural ground surfaces like grass and dirt, and there is an increase in injury. There is a recent study that actually backs up this data of why we call it turf toe, and it was published in the Orthopedic Journal of Sports Medicine in August of 2024, and I want to get this right, so if you want to look it up. The article is titled Lower Extremity Injury Rates on Artificial Turf versus Natural Grass Surfaces in the National Football League during the 2021 and 2022 seasons. Now, what they found was a couple things was interesting. First, they found a total number of injuries between those 2 years as being 718 injuries. And then on the lower extremity, the rate of injury was 1.22 injuries per game for natural grass versus 1.42 injuries for artificial turf. So something that was relatively significant. When we went down to actual foot injuries, such as needing ORIF of the foot or a Liz Frank repair, there was actually a 2-to-1 odds where twice as many injuries were happening on artificial surface compared to grass surfaces. So what is turf toe and what is happening to the area? Well, we are talking about the base of the big toe down and through here. And there's a few bones that we first need to talk about. First is the big long bone called the first metatarsal, and then we get into the toe where we have our proximal phalanx and our distal phalanx. And together these two bones hit each other and propulse and move off the foot. But to help with flexion of that big toe, which is when the big toe is coming down like this to help propulse and move us forward, there are tendons and ligaments that attach under here. That's where these two extra bones come into. These are called sesamoids, and we have two of them and they function just like your kneecap, where they're taking a tendon from before the joint and helping that tendon glide over the joint and preventing the tendon from ripping and tearing. Okay, so turf toe can be an injury to one of these structures. Also though, these two little sesamoids, to help them from deviating or going to the right or the left, these sesamoids are attached by a ligament in between each other called the intersesamoidal ligament. There are also ligaments that help support the inside and the outside portion of the joint to help stabilize anything. So again, turf toe is going to be a garbage term for what happens to any of these areas and structures. But during the injury, what is going on, and if you look at the video from that quarterback this past weekend, is his foot is typically in a plantar flex position and kind of being pushed off like this. And you can see that big toe here is maximally dorsiflexor coming up. And then what happens is you get a big strong lineman or someone else bigger behind you and comes down and pushes down on your foot. And as you can see, my model is trying to fail there. But when you're on a turf surface, that ground puts more pressure through the area and can cause injury, can cause injury to this area. So turf toe we relate on a couple different levels of tearing to the ligaments. A level 1 is just where we strain one of these multiple ligaments in the area. A level 2 is going to be where we have a partial tearing of it. And a level 3 is going to be where we have complete tearing of one of these ligaments involved into the sesamoid complex. And in the podiatry world, we have a classification for when this big toe gets dislocated up here. It's called the JOS classification, and it helps us guide what we need to do in the operating room. In a type 1 injury of this is actually something where we need to go to the operating room because this big toe and these sesamoids gets dislocated dorsally, but all of the ligaments are intact, which means that it's near impossible or absolutely impossible for us to put that big toe back into its spot and let these structures heal because the sesamoids are going to get in the way of what we call a reduction or putting it back into the place. Then we go on to a type 2 is where we actually have that intersesamoidal ligament, it ruptures and it tears, flailing these sesamoids out on either side of the bottom aspect of this big toe. Now, this is not a surgical emergency because typically we can reduce or put the big toe back in its spot and the ligament will eventually heal itself. Now, this can be different for different levels of athletes. Our high school athletes, our non-explosive athletes, we might be more prone to let these things go non-surgical. Our professional athletes, where we need to have a high level of action coming off of this big toe, we need to have a lot of force go through it, we need our structures to be absolutely sound, well, we might then take them to the operating room and help surgically repair that. Repairs of this structure are going to be just suturing and reattaching the ligaments to each other if they're torn, and you have enough real estate for that, or it might be tacking the tendons and the ligaments back into the bone with some suture anchors or some different special devices that we have in the operating room. But anyway, we're going to have a lot of different injuries that can happen to this. The last thing to talk about that can happen in turf toe too is we can get fracturing of these sesamoids. These little bones down here, these little kneecaps, can also get fractured with too much force. Now, this can be just pretty detrimental in itself regardless of the level of athlete, because these sesamoids have pretty poor healing capability because they just don't have the blood flow that other areas in our bodies do. So all of these things put together, between fracturing your sesamoids, between tearing the ligaments that help hold the sesamoids together, between rupturing or tearing the tendons which help guide that big toe and plantar flex that big toe, there's a lot of different things that can go into a turf toe, which can mean your favorite NFL star might be out for a significant amount of time.